If Sylvia didn't live in this part of Belgium, she'd most likely be in a psychiatric hospital.
Look it, a caliper.
But here, in the small city of Geel, around 100 patients live with volunteer host families, sharing in their daily tasks.
I was a year old when my parents and I came to this house, and that's when I started living with patients. You get used to it. For me, they're actually like sisters.
Sylvia lives here alongside 2 other patients. One of them, Renilde, has already spent more than 20 years with this family.
My favorite thing is playing with the Playmobil monkey and doing the dishes. And I like the 2 cats when they sit still.
The family receives around €1,200 a month per patient to pay for food and living costs. Welcoming people like this comes naturally to Janine, whose parents and grandparents did the same.
I got real friendship from it. It's always been like that at home. We've always had this. It's how I grew up. For me, we're not just a host family, but a family full stop.
Professional help is never far away. Even though this family has a long history of fostering, visits from a social worker are a regular fixture.
It's really important that the host families and patients are able to tell us what's going on or when things aren't going well. Typically, we visit families once a month and provide additional support when needed.
The voluntary reception programme for patients is overseen by this specialised hospital. Michelle Lambrecht recounts her home visits to a panel of doctors. Over the years, they've observed the positive effects on some patients of receiving care outside of an institutional environment.
Over time, people with a long history of psychiatric treatment find a new second home and really relax. We can even progressively phase out certain medications. The program allows people struggling with serious mental difficulties to lead as normal a life as possible within society.
But all this can only work if there's real vigilance over which patients are deemed eligible to live with host families.
They can't be a threat to the family they're staying with. If, for example, the patient has hallucinations, that could be a risk to their hosts. So that wouldn't be allowed.
It's a system which works thanks in part to a long history, dating back to the 14th century. Then, pilgrims with psychiatric problems came to pray to Dymphna, the patron saint of the mentally ill. Over the years, visitors were welcomed into locals' homes, but the system would not receive official recognition until much later.
In the middle of the 19th century, there was a law in Belgium that stated that people who were mentally ill should be taken care of or put away in an asylum. It was better for them, better for society. But then, of course, we had Geel. And so, in that law, Geel got a special status.
It's a model which is attracting increasing attention from the scientific community. Geel was even recently cited by the European Commission as it encourages EU countries to review how they approach mental health issues.
We are seeing the big psychiatric institutions now being much smaller, having a number of beds only when necessary, and community care becoming more prevalent. And not only that, we're also seeing psychiatric facilities in the general hospital setting. This is also important, that we don't need huge separate hospitals.
A community-based care system that's gained recognition well beyond Belgian borders and was last year added to UNESCO's list of intangible cultural heritage.